The project was about helping our primary care colleagues in general practice think about patients with frailty and whether or not they would be better off without some of their medicines.
Our main barriers were that we didn't think we'd have the knowledge or language to effectively explain to the patient why we were thinking about offering to stop certain medications, particularly if they were started by a consultant.
There's been lots of really useful resources that the project has enabled us to use to implement the change. Things like the 7 steps approach to medication reviews really just helps you drill down and understand the patient.
There's a chart which looks at the numbers needed to treat for lots of different commonly prescribed drugs, and when you look at it, a lot of these drugs are not as effective as we'd like to think they are.
I think we've tried to improve this system, in particular by bringing the stop application onto System 1. That's a good tool. It's a little bit clunky, but it is actually a good start actually helping in the more complex medication reviews.
We realised we'd have to motivate and involve all the other GPs at the practice. In order to do that, we ran an education programme for all the other GPs, and we set aside a very specific amount of time each week for a GP to see a patient. So each patient in our cohort got a 30-minute appointment with their named GP, and that time was set aside purely to do a medication review and a polypharmacy review.
So looking at time, because we've got a clinical pharmacist, that really helped because she had more time than the GP. So actually having her was invaluable for the project, and we couldn't have done that without having a clinical pharmacist. And she had more time with the patient, she had longer appointments, she had the availability to go out and do home visits and spend more time with the patient.
In a really short period of time, there was a significant amount of work done to stop unnecessary prescriptions. And I think in terms of successes beyond that, there was a real culture change.
You know, why are they on these medications? Do they still need to be on them? So I think it has really focused the mind, particularly my mind, when I'm doing medication reviews for patients.
From the project, it's been a huge boost to my confidence in being able to de-prescribe something that I might not have considered before, so I feel much more at ease stopping medications.
I actually found that there was a lot more of what I call a social care impact, and that a lot of issues that we have are those patients that can't get in or don't get in don't necessarily receive the same service as those that regularly come in.
I've learned a lot. I've kind of had new resources which have given me real confidence in terms of having a conversation with patients where I ask them, well, what's really important to you? And so what I've really got out of it is the confidence that when you start asking patients what really matters to them, then we can partner together better, and then patients are more invested in the medication they want to take. But there might be some things that we agree together probably actually aren't doing them a lot of good, or the side effects are too burdensome, and so sometimes we can reduce people's medication as well.
Service users felt that they'd had a much better service and that we are actually providing them with a much better review.
A lot of hospital admissions are related to adverse drug reactions or side effects of drugs. That it felt really successful that we're at least cutting down the risk of that by de-prescribing.
A patient in a nursing home, been there a long time. I'd known him for quite a while actually. I went through one of these detailed medication reviews with him, with the nursing staff there and with his wife. And then a few weeks later we'd made a lot of changes to his medication, huge amount. And I spoke to his wife and said, you know, where are we up to, how are things going? And she was very keen that we just stop, and she said, you've hit the sweet spot, this is perfect, this is great. We've not played dominoes together for 5 years, we're playing dominoes together. You know, I've got my husband back in many respects, and this is a guy in his late 80s, advanced dementia, but we still had a significant impact towards the end of his life.
Part of this project has probably changed my perspective in terms of polypharmacy for probably the rest of my career, really. It's really kind of opened my eyes to the dangers and how problematic polypharmacy can have a really detrimental effect on patients' lives.
For us, what was really important was for the project to have a legacy, and the educational programme that we ran alongside the reviews that we were doing probably has the biggest impact, and the most important part of our project is the legacy that it's left us with.